This is a patient counseling between the clinical pharmacist and 65-year-old geriatric patient. The clinical pharmacist goes into the cardiology ward and does a bedside patient counseling with the geriatric patient who was diagnosed with angina pectoris and is depressed about it. So let's begin. Hello, good morning, sir. How are you feeling now? Are you taking all your medications properly? 1 minute. Don't ask me any questions. Just leave me alone or allow me to go home back. Okay, we will allow you, sir. But can I ask you one thing? Are you missing your family? Yes, I am fed up of this hospital environment and I want to go home as soon as possible. I want to spend time with my grandchildren and let back my normal life. So, only, sir, we all healthcare professionals are working together to make you well as soon as possible and make you follow all the instructions that we tell during the counseling so that you can get well soon and go home early. So, can I counsel you for a while, sir, if you permit me? Yeah, I'm ready to follow your instructions if I can go home early. By the way, you didn't introduce yourself. Myself, a clinical pharmacist who has come here to instruct you about your disease and the steps or the points that you need to follow to get well soon. Think like I'm your grandchild who is instructing you to follow few things. Is it okay? Yes, so definitely I am ready to follow the instructions if I can go home. Very good. So let me see your reports. Okay. So you can tell me what problems or the symptoms you felt during admitting in the hospital? I was having chest pain, I was feeling suffocation, and even stomach pain, and even I was feeling tiredness. So, now are you feeling better after taking all the medications? As now I feel a little better, but don't feel like taking this medication anymore. Okay, then tell me one thing. Do your grandchild cry when you don't buy them chocolates and they want them? Yeah, they usually do that. Okay, it's somewhat same situation with your disease. You don't have to worry about it. Your heart is just little bit crying because it is not getting proper blood supply. So it is necessary that you take all the medication properly and help your heart to get the blood so that it will stop crying and stay happy so that you can go home and enjoy back your normal life. Will I go home early if I take all the medication properly? Then I will follow your instruction. Yes, definitely you will get well soon. So let us see what are the medications that are given to you and how and when to take them. So the first medicine is nitroglycerin. This drug starts with the letter N and you can see this tablet is white and round. So it has also N and 4 print on that tablet. We usually give this tablet to treat your squeezing chest pain you feel, and this is mainly you have to keep this one tablet under your tongue and allow it to dissolve. You should not eat, drink, smoke or chew any kind of tobacco products while the tablet is dissolving in the mouth. Do not chew or swallow the tablet. Precaution that you have to maintain is do not do any machinery work or any work that requires your concentration, because after you take this drug you may feel dizziness, headache, fainting, so it's better you take rest for a while. So the next medicine is starting with the letter A, that is Ethynol. So this mainly we give to keep your BP in the normal level and prevent all the worsening of your pain. And the dose is mainly you have to take 25 mg orally on an empty stomach, one in the morning and one in the evening. So the precautions that you need to take is this tablet intake may cause dizziness, tiredness, so better you avoid the machinery works and take rest for a while. Now, after knowing the importance of each of the medicines, do you feel like stopping them? No, but doing this much, is it enough? Yes, But along with this, you need to follow certain lifestyle changes that will help you to get well soon and be perfect in your condition. Then tell me soon. I will definitely follow. I don't want again to admit in the hospital. No, don't worry. Just follow these steps. First is you need to do your dietary changes. In that, dietary foods, heavy meat, foods that are cooked in palm oil and coconut oil should be avoided. Eat plenty of fruits, vegetables and whole grains. Avoid food that contain high level of salt. Read the food labels and avoid food that contains saturated fat and hydrogenated fat because these are unhealthy fats found in the fried and processed foods. Next is do aerobic exercises for at least 30 minutes per day in 3 to 4 days in a week under proper guidance and do it slowly. Next is you need to regularly monitor your BP. If any larger changes you see, then it's your duty to inform the physician. Reduce all the stress levels and always be busy in some activities so that you forget about your stress and the disease. Lastly, I saw in your case sheet that you have habit of drinking alcohol. As I am due to the stress, I got addicted to that. Stress? What was your occupation? I was working as a bank manager, so there was a lot of stress and workload at that time. But in this condition, you need to limit it. Don't withdraw it suddenly. Just limit the use and then stop the consumption of alcohol. Yeah, surely I will follow this. What if I forget or remembering all this? Don't worry, I will give you this leaflet that contains all the information. We all hope that you will recover soon and go home happily. Thank you for being so much concerned and God bless you. You're always welcome. Thank you for hearing with so much of patience and listening to the instructions. Any questions or any doubt, feel free to contact any of us. Thank you so much, doctor.